Hello, welcome to my site. I'm Dr. David Pascal. And if you are here, it's because you have an interest in complex regional pain syndrome, CRPS, or its old name, RSD, reflex sympathetic dystrophy. The typical story of someone that has CRPS, the way that it evolved in their bodies is you have a apparently normal, healthy person, and something happens. So, say they sprain their ankle or maybe even break a bone in their foot. That hurts a lot. They go to the ER, they take x rays, they get an exam. The person's in an appropriately high level of pain because they just severely sprained or broke a bone. And then they're put into a cast or a boot and they go home. And what we would expect is for that pain to slowly decrease over time. Maybe the hospital gave them a painkiller. And so that 9, 10 level pain should be more like 8, 9 level pain, or if they're lucky, it's 6, 7 on a 1 to 10 scale. And gradually over time, it goes down and down. But that does not happen with CRPS. People with complex regional pain syndrome, what happens with them is they break a bone in their foot, they severely sprain their ankle, they have pain, they go to the ER, they're evaluated, put in a boot, and when they go home, the pain doesn't drop. The pain actually gets even higher, and it gets higher and higher until they really can't stand it anymore. They'll call the hospital, they'll call their doc, they'll say, "Hey, this hurts even more." Since this is a super rare neurologic disease, only about 100,000 people in the entire country have it. The usual response from the hospital will be, "Hey, take more meds, rest more, it'll go away." And after 2 or 3 days of this, when the pain is literally excruciating, they go back to the hospital, they take off the boot, they take off the cast, they do more films or special studies. They don't see anything uniquely different, but now that pain is locked in. And no matter what they do, no therapy, no drug, no rest really makes any significant impact. The next thing that happens though is that pain doesn't just stay wherever the original pain site was. Earlier I gave the example that it started in the ankle, but it could have been the hip or the wrist or the shoulder. But wherever it is, then it starts to spread. So if it was in your right ankle in the beginning, that pain will typically spread to the end of the foot. And then once it's done that, it engulfs the entire foot. And then from there, it works its way up the calf, like halfway up the leg, and then to the knee, and then halfway up the thigh, and then all the way to the hip. And now the person has unrelenting, horrible pain. Maybe the skin is so sensitive that even a breeze of air or clothing itself is too painful to even bear. And unfortunately, CRPS spreads. So the next thing that happens is once that whole limb, the whole right leg or the whole left arm is involved, then the same symptoms jump over to the other side. So then you have your whole right leg plus your left foot, and then your whole right leg and your left foot and your lower left leg, and then your whole right leg and your whole left leg. And then it goes to the arms and one arm and then the other. And so you've got both legs, both arms, and then it goes to your trunk. And people present to my office in full body CRPS. So their whole body is 9, 10 level pain 24/7. CRPS is so difficult to initially identify and diagnose for a couple reasons. One is when someone has high level of pain, the doctor can't tell. I can't tell that you have pain. I can't tell that you have a symptom. I have to take your word for it. And medical doctors or chiropractors or acupuncturists that haven't seen CRPS find it difficult to believe that a person could actually have that much pain. So they don't believe you. They say it's all in your head. They say you may have pain, but it can't be that big because your labs look normal, your x-rays look normal, your MRI looks normal. There's no massive pathology there. And so as the patient, you're starting to wonder, like, is this in my head? They can't find anything. They're the experts. And you begin to question yourself. So it's difficult to diagnose because people can't see it. There isn't a specific outward sign that the doctor can find. And so the diagnosis is usually only made down the road, months down the road, when someone comes and we see that they have so much pain and dysfunction and there's no visible cause to it, then they're put into this diagnosis of complex regional pain syndrome. The next part of this is why it's so difficult to treat is, first of all, you can't treat what you don't believe in. So a lot of doctors, since they don't believe it, they are saying, okay, let's do some mental health care, or let's just try basic physical therapy things that aren't really specific to this level of pain. And so those aren't effective. I believe that once someone has CRPS, they don't just have a neurologic problem. They don't just have pain in their leg. When it gets to that point, you have impacted the entire body. People that are in long-term pain, it does impact their brain. They can't sleep. When you don't sleep, then your body's ability to heal starts getting compromised. When you're in high levels of pain, you can't really eat. Your stomach is upset. You eat foods that start to disagree with you, and as CRPS progresses for many people, they end up only being able to eat one or two things. Some people can't even eat any foods and they're put on feeding tubes. So now the body's developed all these food sensitivities, food allergies, and you have your digestive tract involved. 70% of our immune system is in our digestive tract. All of our neurotransmitters, the chemicals that make our brain work, are made in our digestive tract and then shipped up to the brain. So these patients that have been in long-term pain, they end up involving their digestive tract. They end up involving all the neurotransmitters in their brain. The inflammatory markers will start going up. So you bring in the liver starts to have a problem, the pancreas, the blood sugar levels go off. So the kidneys get involved. Every organ and system in the body just slowly gets more and more stress on it. And even while the blood labs might look normal, we're having organ dysfunction on one level or another. But the loudest voice, of course, is the screaming pain that the patient has. And so the treating physicians tend to just look at that. What is different in my office is I've developed this method to treat patients with CRPS. The Pascal method looks at your body as a whole, not just your leg or your wrist or your knee. Because by the time you're in this much pain, as I said, your digestive system is involved, your entire nervous system is involved, your immune system has been severely compromised. And so my treatment is to first evaluate and document all the deficits of each system, right? Your respiratory system, your digestive system, your nervous system, what's going on with all the lobes of your brain, the neurotransmitters, what's going on with your small intestine, what's going on with your stomach, your liver, and see where all the deficits are, and then address all of them, not just the pain, because at this point, it's the entire body is hurting the entire body. So you have to rebuild or support normal function globally. And by doing that, then we are able to turn the tide. The pain levels start coming down. That means the inflammatory markers come down. The digestive tract starts working better. You're getting more nutrients on board. That boosts the body's ability to heal itself. Your neurotransmitters are coming back online. So the brain fog goes down and we slowly cycle the body back up in this almost like a juggling act. We're not just looking at the pain. We're doing, okay, here's some work on the liver. Here's some work on the neurotransmitters. Okay. Now we're doing the digestive tract. Now we're doing sensory work. Now we're addressing the muscles, which have started to dysfunction because you haven't been able to exercise for 6 months or 6 years, as these people with CRPS have slowly degenerated. So it takes a, a healing approach across the board to bring that person out of pain and back into normal function. And what I found in all the years that I've been doing this is that approach is a very successful approach. People call my office and they wonder, why do you get success when other people don't with CRPS? Why I've already been to John Hopkins or Stanford or Emory. I've already seen the top neurologists and the top chiropractors and the top nutritionists and the best that I could find. And I still have my problem. Why are a chiropractor in Cary, North Carolina able to help when all of these other institutions have not been able to help? And I think there are a few reasons for that. One is experience. I'm in my 37th year of treating patients. So I have almost 4 decades of actual experience working with patients. And my journey didn't start when I saw my first patient. My journey started 10 years before that to start learning all the things you have to know about bodies to become a doctor. So I have 50 years of study, 50 years of learning, of trial and error that have come together and greatly help my ability to diagnose and treat. Another thing is that I used to be an elite athlete. I was a world-class athlete. And to be an exceptional athlete, yes, you have to have that God-given talent, but you also have to have this drive to push yourself at a level that other people are either unwilling or usually unable to even comprehend. And I knew growing up as a child, before I even had the drive as an athlete, I knew within my heart that I wanted to be in the healthcare field. I knew that I wanted to spend my life helping others. And this is a 8, 9, 10-year-old. And when I became an athlete in my early teens, then I started to get a love of that competition and I became better as an athlete, driven. So being driven to help others at a young age and then taking that focus that I had that led me to be an exceptional athlete. Then once my athletic career ended, I rolled right into chiropractic school. And when I came out of school, I had that drive to, I want to be the best that I can be. I want to serve my patients to the highest level. So I have always taken way more courses, way more study than than is required by the state and federal government to maintain our licensure. And I have been fortunate that right from the beginning, the universe has sent me very difficult patients. So from the beginning of my career, I've had people in terrible pain with the people with different neurologic diseases, with crazy orthopedic things, people born blind or with MS or in terrible car accidents that were paraplegics. And so from the beginning of my career, I was learning, and like everyone, you learn through experience. You say, "Hey, I think this will work," and then it doesn't work. You learn through trial and error, and you go to seminars. And so I've got 50 years of going to seminars and studying and 40 almost years of clinical experience with patients. And I have brought all of that knowledge into my system. And that's the main foundation of why I get results. The other reason why I am able to help CRPS patients when others don't is, as I mentioned before, I have a global approach and I develop systems that approach the nervous system a little differently from the typical chiropractor or neurologist. I developed systems that help reset, rebuild the immune system in a way that others haven't thought of. And I've been fortunate in my years to actually have developed 4 different techniques. And because of those efforts and because of my study, patients come to me from all over the world. They come from Australia and Africa and Asia and Europe and South America, the Caribbean, all over the North America. I've been fortunate because of the way I've been able to help people that I've been in national magazines, I've been in mentioned in books, I've been featured in 3 different documentaries, and that has brought even more patients to me. And the patients that are coming to me are the ones that have already seen 30, 40. I've been the 50th doctor that a patient has seen. And that type of clinical experience is very rare, very rare. So there are only a handful of people on the planet of healthcare providers that have had that scope of practice and exposure. And that's another reason why I'm able to get results when others may not have. And probably wrapping around all of this in terms of getting great results with my patients. And then maybe my best skill is that I'm a very good listener. Most of the CRPS patients that come to me, they say their doctor doesn't listen, their doctor doesn't believe them. Their doctor probably doesn't believe them because their doctor doesn't have experience in CRPS. But the doctor doesn't listen because most people, unfortunately, in healthcare are not great listeners and they're missing a lot of data. So I spend a lot of time sitting down with my patients one on one, really listening to their whole story because there's information in there, there's clues in there that lead to better results. And you have to start with that. So if you come to see me, we're going to have a long conversation. I'm going to hear all the steps of your journey so that I can take that information actively, proactively listening so I can get that one little clue that's going to open the door and give me more success with you. And I think that is vital. And I've been fortunate over my career. As an athlete, I always had a coach, and my coaches helped me become a world-class athlete. When I became a doctor, I started mentoring other doctors, and there are doctors literally all over the planet that I have trained in advanced neurologic work. I have trained in CRPS. Some of the biggest, most successful clinics on the planet are run by doctors that I mentored. And I am proud of that. And I feel great about that because it's wonderful when I'm able to help a patient. But if I teach a doctor what I know and using my approach, Pascal methods, that then they're able to go and help, you know, even more people. And so even though I'm not in the room with that patient, I'm impacting their care. And so I feel blessed and fortunate to have had a global impact on CRPS for patients that I never even actually see. When patients are considering coming to my clinic, they want to know what to expect. And the first step is to contact my office. We set up a consultation. Usually that's a Zoom call where we have you fill out paperwork. You send it to me. I've got your health history. I've got your labs. I've got a pretty good idea of everything that you've done. And then we do a call. Not every person is the right fit for my clinic. I'm not the right doctor for everybody. And we need to figure that out first because I only accept patients that I feel I can really help. So we figure that out with the initial paperwork and with a conversation. If it looks like I'm the right person and you look like you're the right patient for my clinic, then the next step is you're going to come to me. And you have to look at planning on staying at my office anywhere from 3 to 6 months. This is another reason why most treatment fails is even some doctors that are doing the quote unquote right things to help a patient, they're just not doing enough of it. It's just like if you went to the gym 1 day a month for a year, you, you went to the gym 12 times. It's not enough to get into shape. You have to go 3 times a week to make a physiologic change. And that's another part of my method is that I found that CRPS has had such a global impact on the body, you need to pour in a massive amount of care. So patients will be looking at coming and staying at my clinic. We're going to see them every single day, 5 days a week. They're going to be in the office for multiple hours doing all these different treatment modalities to actually make a physiologic change. So when you're coming, you have to plan on the time and you have to be committed. Some people say, I'll just come for 2 weeks and see how it goes and then go home. I won't even accept a patient like that because that's not a system that works. I figured out a way that works. You don't have to figure it out. You're coming to me because you and the doctors you've seen haven't been able to do this. It's my job to figure out what care and how much care it takes to get better. And then I monitor this. I monitor it every single day. I will see you every single day that you're here in my office and get feedback. Where are you at? How do you respond to the last care? What's going on? And I don't use a cookie cutter system. I have over 61 different treatment modalities in my office and 50 years of knowledge and almost 40 years of clinical experience. I mush that all together and I'm micromanaging. I'm changing what we're doing every day, sometimes several times within that day, so that I can best provide care for you to get better. And that effort is vital and one of the major keys to why we get results that many other clinics are unable to.
Yes.
After we've done our Zoom consultation and we've decided that we're a good fit and you arrive at my office, then we're going to still have more conversation on that first day, and that's going to roll into an exam. And the purpose of my examination is to document where you're at and to see how your body responds to a few key neurologic tests that I use that for many people, even during the test, their pain levels will drop dramatically. They won't stay down, but because it's just a test, it's not the treatment, but the mere fact that they have significant pain drops on the very first day that they're in my clinic, that lets me know we're going to go down a certain path, a treatment path in my office. For patients that don't have a pain drop, that's super valuable information too. Doesn't mean I can't help. It tells me, okay, they get funneled down a different main pathway in my office. So by micro detailing your history and your experience up to this point, and then doing a very detailed neurologic and immunologic evaluation of your body on that first day. Sometimes it even takes a couple days of testing. It takes as long as it takes because we need to have all the information it takes to come up with a treatment plan. I take all that information and then I sit down with all of our conversations that we've had, all of the lab reports, all of the special studies, all of my own in office testing. And then I come up with a treatment plan. You come back in that next day or the next afternoon once I've been able to develop that, and we talk about it. I say, "This is what I found. This is what I think. Here's our main outline of care," and then we begin. And I've had patients, for example, one young woman who had CRPS for years, Katie McMillan. Not only did she have pain, CRPS pain, but she developed a neurologic tic. And even just walking, the attempt to walk, her whole body would jolt and jerk. And she had no quality of life. Well, in my initial evaluation, I found problem in her spinal cord and I was able to do a correction and that tic that had been there for months instantly stopped. Yeah, it was awesome, and I'm sure I posted a video somewhere on my website where you can go and see her walking down the hall with this full body tick, and then walking down the hallway of my office the very next day without a tick. Now, we were able to get that change, and then it took time for her nervous system to heal up and lock in. But when she left our office, she was stable. She went home. She went back to school. She went back to sports. And as of right now, she's still in complete remission. Of course, it's fantastic on that first day or second day when I have a patient and they're in high level CRPS pain, and I'm able to do a neurologic test and their pain dramatically drops. And with those patients, the pain comes, they're out of pain for a minute, and then for 5 minutes, and then for half an hour, and then for half a day. And as they progress over time, what we see is the high levels of the amount of time that they're in high pain gets smaller and smaller. And then the high pain level starts to drop. So they go from a 10 to an 8 to a 7 to a 6, and the duration that they're in pain is getting shorter and shorter. But while this is going on, of course, we're doing all this repairing, right? We have to rebuild their digestive tract, rebuild their nervous system. If it's been months or years that a person has CRPS, there's muscle atrophy that has to be addressed. So bodies take time to heal, but as you're healing, those symptoms are coming down. That's great. But not every patient is in that category. We have plenty of patients where during the testing, we don't change their pain levels at all. They're still in high pain. Light touch or sound or eating something just flares them up and they're in agony and they have brain fog and they're in wheelchairs and there's no change. But here's the deal. This is what we know is that because we've been able to see so many people, we know what happens when you treat a person. Is if someone is in the bottom of 100-foot well and you throw them down a rope and you tie the rope, you have them tie the rope around themselves and you say, okay, look around. What do you see? And they say, all I see is black. Ask that CRPS patient, what do you feel? They say, all I have is horrible pain. And then I pull on that rope and I pull and I pull. Let's say we raise them up 10 feet and I say, okay, I did what I know it takes to start getting you out of the bottom of this. Look around. What do you see? And the patient says, it's still pitch black. Everything's pitch black. Or in the case of pain, yeah, I still have high pain. You treated me and my pain's still the same. And it is. But we've made a physiologic, we started that road towards physiologic improvement. So then the next day they come back and I pull on that rope and pull on that rope and pull on that rope and they go up another 10 feet. And if you ask them, what do you see? They go, hey, I've been here for a day or a week or a month and there's no change. It's still pitch black. Everything's still pitch black. Well, we know they were at the bottom of 100 foot and then they're 10 feet higher and 20 feet higher and then 40 feet higher and 90 feet higher. If you keep doing the same things that will pull them out of that, eventually they'll pop out the top. And that's what we do with our CRPS patients is yes, they may still be in pain every day, but we're doing the things that we know heal the nervous system, restore normal neurologic function, detox the body, decrease inflammation. You just keep doing all of those things because physiology is physiology. If you do enough care, the body will start rising up out of that hole and eventually they'll pop out. And so, even for those patients that don't have relief in the beginning, for the majority of the patients that I've seen, we've been able to get them out. And not everyone. We definitely can't help everyone. There's probably 20% of the people that come to us where we have little or no effect at all. And for those patients, I want to find out who they are as quickly as possible. So I'm staying in constant contact, constant feedback, trying to do every single thing that I can to actually shift that body, and if I can't shift it, to know, hey, is this a person that really isn't going to make improvement in my system or not? Because the last thing I want in my office is for a person to waste their time, waste their money, be in pain longer. So I want to be able to figure that out as quickly as possible. And I'm doing the best that I can to help and to figure that out. So ultimately, if you're one of those people that starts to change and improve, then people want to know, how long does it take? That's like saying, how long is a piece of string? Some people are fast healers, some people are slow healers, some people have three contributing factors, some people have 87.2 contributing factors. Everyone is in their own journey, but we are doing our best to move a person out of pain and into normal neurologic function, normal life function as quickly as we can. And when you start seeing those results, then you know, okay, we see a light at the end of that tunnel and we continue working toward that. And so that is why it is so important to go through the entire system of my method. And all of that starts with that initial Zoom consultation. I have a pretty high success rate and I'm proud of that. And my staff works very hard to help all of the people that come see us get better. I can't help a patient that doesn't come to me. So the first step is to look at the links below this video and contact my office. That's the first step. Reach out. Even if you're not sure I'm the right person for you, let's talk. I may not be the right doctor for you, but we're never going to know if we don't have that first consultation. So click the link below, contact my office, and you and I will talk and we'll go from there.